Have you ever stopped to think that the way you prepare for bed might be doing more harm than good? It sounds hard to believe, but data from the National Institute on Aging shows that tens of thousands of older adults face serious health events during sleep each year, many of which could be traced back to simple, everyday habits. After age 60, your body's ability to stay cool, regulate blood pressure, and clear toxins slows down. What once felt like no big deal bedtime routines can turn into real health threats, yet most of us keep doing the same things night after night, unaware of the hidden risks. In this video, we'll uncover 7 common sleep practices that put seniors at risk. Tick around for habit number 5. It affects more people than you'd guess. Now, before we begin, drop a comment below telling us where you're watching from so we can say hello. Now let's get started. Habit number 1. Sleeping in a hot room. We all want a cozy bedroom, especially as we get older. Turning up the heat, piling on blankets, or closing windows can feel comforting on a cool night. But when your bedroom temperature stays above about 67 degrees, 19 degrees C, you may be undermining your sleep and your health. For seniors, a cool room isn't just more comfortable. It helps trigger the body's natural drop in core temperature that signals it's time to rest. As you fall asleep, your core temperature should fall by about 1 to 2 degrees. That drop helps you move into deep restorative sleep. When the room is too warm, your body works overtime to shed heat instead of relaxing. You may find yourself tossing, turning, or waking up drenched in sweat. According to a study in the American Journal of Geriatric Psychiatry, older adults sleeping in rooms above 70 degrees spent up to 30% less time in slow-wave sleep, the stage linked to memory consolidation, tissue repair, and immune support. Missing that deep sleep night after night can drive up inflammation, raise daytime blood pressure, and weaken your immune defenses. Beyond poor sleep quality, overheating at night can lead to dehydration. Seniors often lose some thirst sensation, so you may not notice fluid loss from sweating. Dehydration thickens your blood and strains your heart as it works to circulate fluids. That extra strain can trigger irregular heart rhythms or even raise stroke risk. If you have a history of heart disease, a hot bedroom effectively forces your heart and lungs to work harder just to cool you down. Heat stress also interferes with hormone release. Growth hormone, released during deep sleep, helps maintain muscle mass and bone density, 2 key factors in preventing frailty and falls. When you lose slow-wave sleep, growth hormone drops and muscle repair slows. Over time, weakened muscles make it harder to stand up, climb stairs, or recover from minor injuries. So what temperature should you aim for? Most sleep experts recommend 60 to 67 degrees. That range allows your body to cool naturally and stay in deep sleep longer. If you tend to feel chilled, layer bedding rather than turning up the heat. Choose breathable fabrics like cotton or bamboo that wick moisture. Keep a light blanket nearby for brief warming when you first slip under the covers, then shed it if you feel warm. Improve air circulation with a ceiling fan set on low or a small oscillating fan. Even a slightly open window can bring in cooler air and help remove body heat. If you rely on an electric blanket, set it on a timer to turn off after you fall asleep, or choose a low heat setting. Habit number 2, getting out of bed too quickly. Have you ever risen in the morning, swung your legs over the side of the bed, and felt a sudden wave of dizziness or darkness at the edges of your vision? For many seniors, that moment of lightheadedness is more than a brief nuisance. It's the sign of orthostatic hypertension, a sudden drop in blood pressure when moving from lying down to standing up. This condition affects up to 20% of people over age 65 and is a leading cause of falls and related injuries. When you stand too fast, blood pools in your lower limbs before it has a chance to pump back up to your heart and brain. For a few heartbeats, your brain receives less oxygen and glucose, creating that dizzy or faint feeling. Nighttime and early morning hours are especially risky. Your blood pressure dips naturally during sleep, and many blood pressure medications take effect overnight. Combine that with stiff blood vessels or age-related decline in blood volume regulation, and you have a recipe for a sudden drop. Falls during these episodes can be severe. Hip fractures, wrist breaks, and head injuries are common outcomes. Recovery for seniors often involves long hospital stays, physical therapy, and a high chance of losing some independence. According to JAMA Internal Medicine, seniors with orthostatic hypotension are up to 3 times more likely to experience recurrent falls. Fortunately, you can train safer habits into your routine. First, when you wake, sit on the edge of the bed for at least 30 seconds. Flex your ankles and tap your toes to pump blood back toward your heart. Take several slow, deep breaths to gently raise your blood pressure. Keep a glass of water on your nightstand and sip it before standing. Mild dehydration makes orthostatic hypotension worse. Use night lights or motion-activated lights to avoid startling yourself with sudden brightness. Keep your path to the bathroom or wardrobe free of clutter and loose rugs. Wear non-slip slippers with good support. If you need to grab something overhead or bend, do so slowly and hold on to stable furniture. If you take blood pressure or heart medications that may lower your pressure, ask your doctor if adjusting the timing or dosage could help. Some seniors benefit from adding a small amount of salt to their diet or wearing compression stockings to reduce blood pooling in the legs. Always check with your healthcare provider before making these changes. By adopting a deliberate rising routine and checking in with your doctor, you can reduce dizziness episodes, avoid dangerous falls, and keep your independence and confidence in the morning hours. Habit number 3, drinking too much water before bed. Staying well hydrated is crucial for everyone, and for seniors it's especially important. Water helps every cell in your body, keeps joints flexible, supports digestion, and keeps your temperature steady. But when you drink a large volume of liquid in the hour or two before bedtime, you may be setting yourself up for trouble. As we get older, our kidneys lose some of their filtering power, and our bladder holds less fluid. Signals to empty your bladder become stronger and more frequent. That big glass of water, herbal tea, or juice late in the evening can send you stumbling out of bed multiple times a night. Getting up in low light, perhaps already groggy, and moving to the bathroom is one of the most common causes of falls among older adults. In fact, falls rank as the leading reason seniors end up in the hospital for injuries. Even a short trip across a dark room can go wrong. Blood pressure drops when you stand up, balance doesn't respond as quickly, and obstacles or loose rugs can turn a simple walk into a dangerous slip or trip. Beyond the risk of falling, nocturia, waking to urinate, fragments your sleep cycle. Instead of flowing smoothly through the stages of light and deep sleep, you keep rerunning the lighter stages. Over weeks and months, this chronic sleep interruption adds up. You may start to notice memory lapses, slower thinking, or difficulty focusing. Research links poor sleep continuity to inflammation, mood shifts, and a higher chance of developing Alzheimer's or other forms of dementia. Missing out on deep sleep also weakens your immune defenses, so colds, flu, and infections become more frequent and harder to shake. There's also a cardiovascular angle. Your heart and blood vessels work harder to process extra fluid late at night. If you already have high blood pressure or a weakened heart, this extra load can trigger irregular heartbeats or sudden changes in blood pressure. These fluctuations increase the chance of nighttime episodes like angina or even a heart attack. So how do you stay hydrated without risking your safety? First, spread your fluid intake evenly during the day. Aim to drink most of your water before late afternoon. Once the evening arrives, taper off. If you feel a bit thirsty close to bedtime, take just a few small sips rather than a full glass. Avoid drinks that act as diuretics in the evening. Coffee, black or green tea, and some fruit juices all increase urine output. Next, make your nighttime bathroom visits safer. Keep a clear path from your bed to the toilet. Remove rugs or any items that could trip you up. Install a night light or motion-activated light so you don't have to fumble in the dark. When you get up, sit on the edge of the bed for a moment. Let your blood pressure stabilize, then stand slowly. Habit number 4, taking certain medications before bed. For many seniors, evening medication routines are part of winding down, but some drugs taken at night can have unexpected, harmful effects. Changes in how the body absorbs and processes medications with age make side effects more likely, especially during sleep. Let's start with sedatives and sleeping pills. Benzodiazepines like diazepam, clonazepam, and alprazolam slow the central nervous system to ease anxiety and induce sleep, but they also depress breathing. In seniors with heart or lung conditions, this can worsen sleep apnea or cause dangerously shallow breathing. A study in the British Medical Journal found regular benzodiazepine use in older adults raises the risk of falls, fractures, and even death. Lingering sedation the next morning can cause unsteady gait, confusion, and increased accident risk. Antidepressants and muscle relaxants, sometimes prescribed at night, can disrupt the deep stages of sleep essential for memory and healing. Over months, that leads to cognitive slowing and greater forgetfulness. Non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen or diclofenac, relieve pain but can irritate the stomach lining, impair kidney function, and interact with blood thinners to raise bleeding risk. Blood pressure drugs offer another challenge. Taking certain antihypertensives too late may drop your pressure too low during sleep, reducing blood flow to the brain and increasing dizziness or fainting. Conversely, if timed poorly, they may not protect you during early morning hours when heart attack risk peaks. The journal Hypertension reports that adjusting medication timing to align with your circadian rhythm can improve blood pressure control and lower cardiovascular events. Drug interactions are the greatest hidden danger. As liver and kidney function slow with age, medications clear more slowly, and levels can build up. Mixing sedatives, painkillers, and other prescriptions without review can amplify side effects or trigger severe complications. How can you stay safe? Keep an up-to-date list of all your medications and share it with your doctor or pharmacist at every visit. Ask whether any nightly doses could be moved to daytime or replaced with gentler alternatives. Explore non-drug sleep aids like relaxation exercises, warm baths, or white noise machines before adding medication. If you need pain relief, try physical therapy, gentle stretching, or topical treatments. Monitor your blood pressure at home to see how timing affects readings and discuss adjustments with your provider. Habit number 5, eating late at night. Next, let's look at a habit that many seniors turn to for comfort: a late night snack. It feels like a small treat, but eating late can cause a cascade of problems, especially after age 65. As we get older, our metabolism slows, digestion takes longer, and our bodies become less efficient at handling sugar and fats. When you lie down shortly after a meal, your body is still busy breaking down food instead of repairing tissues and clearing out toxins. The most obvious issue is acid reflux. Lying flat makes it easier for stomach acid to splash up into the esophagus, creating that burning feeling in your chest. Over time, repeated acid exposure damages the lining of the throat, leading to chronic inflammation. For seniors with hiatal hernia or weak esophageal sphincters, the risk of silent aspiration, tiny amounts of stomach contents entering the lungs, increases. That can trigger pneumonia and contribute to long-term lung damage. Late eating also spikes your blood sugar at a time when your body is less capable of processing glucose. Older adults often develop some degree of insulin resistance, so a dessert or carbohydrate-heavy snack after dinner can keep your blood sugar higher for longer, increasing the risk of type 2 diabetes, or making blood sugar harder to control if you already have it. High overnight glucose can damage blood vessels, nerves, and organs over time. Your heart doesn't get a full rest either. Normally, blood pressure dips during sleep, giving the cardiovascular system a recovery period. But digesting a heavy meal keeps your pressure elevated longer into the night. That non-dipping pattern is linked to higher chances of heart attacks and strokes. Fatty or salty meals late can trigger irregular heart rhythms in people with atrial fibrillation or other heart conditions. Poor sleep follows too. Discomfort from indigestion can wake you, leaving you tossing and turning. Fragmented sleep worsens memory, mood, and immune function. You may wake feeling unrefreshed, with daytime drowsiness and reduced focus. What can you do instead? Finish dinner at least 3 hours before bed. That gives your body time to digest and your stomach time to empty. Choose lighter evening meals, a piece of grilled fish or chicken with steamed vegetables, a small salad with beans, or a bowl of broth-based soup. If you're still hungry later, reach for a gentle snack, half an apple, a small handful of almonds, or a few whole grain crackers. Avoid sweets, heavy sauces, fried foods, and large portions of pasta or rice. Habit number 6, sleeping in the wrong position. Let's talk about something many of us barely notice, the position we sleep in. For younger people, sleep posture may feel like a minor detail. But for seniors, it can be the difference between breathing smoothly and waking gasping, between a steady heartbeat and unexpected arrhythmias, between clear thinking and foggy memory. Sleeping on your back, what experts call the supine position, might seem comfortable, but it can bring several hidden risks. Gravity pulls your tongue and the soft tissues of your throat backward, narrowing your airway. Even if you don't snore loudly, this slight blockage reduces oxygen intake. Over time, reduced oxygen stresses the heart and brain. Occasional dips may speed age-related cognitive decline. It can also trigger episodes of sleep apnea where breathing stops briefly and then restarts with a gasp. Each pause jolts your heart and raises blood pressure. Back sleeping also makes acid reflux worse. When your head and chest lie level, stomach acid flows more easily into the esophagus. Seniors with weakened muscles around the stomach opening are especially vulnerable to nighttime reflux, which can inflame and scar the esophagus and heighten the risk of aspiration. Research on brain health shows side sleeping helps the brain clear waste proteins more efficiently. On your back, that clearance drops dramatically, allowing harmful proteins linked to dementia to linger longer. Side sleeping also supports blood flow, reducing strain on the heart's arteries. But not all side sleeping is equal. Sleeping on your right side can compress your heart's major blood vessels and force your heart to work harder against gravity. Instead, sleeping on the left side offers a host of benefits. It encourages smoother digestion, keeps acid below the opening of your stomach, and supports better blood flow from your organs back to your heart. It also aligns your spine more naturally, easing pressure on your hips and lower back. Making a change can take effort. Place a firm pillow between your knees to keep hips level and reduce rolling. Use another pillow behind your back to stop yourself from shifting onto your back during the night. An ergonomic neck pillow will cradle your head, keeping your spine aligned. If reflux is severe, elevate the head of your bed by a few inches. This keeps acid in your stomach by using gravity to your advantage. Habit number 7, ignoring snoring, breathing stops, or insomnia. Snoring is easy to dismiss as harmless noise. Insomnia can feel like a normal part of aging, but for seniors, these signs often point to a serious condition, obstructive sleep apnea. In this disorder, throat muscles relax too much during sleep, collapsing the airway. Breathing may stop for 10 seconds or more, dozens or even hundreds of times a night. Each pause in breathing causes oxygen levels in your blood to fall. Your heart must work harder to pump oxygenated blood to your tissues. Over months and years, this strain raises blood pressure, triggers irregular heartbeats, and increases the risk of heart attack and stroke. The Sleep Heart Health study showed untreated sleep apnea raises fatal heart attack risk by 30% and stroke risk by 60% in older adults. Nearly 40% of seniors have sleep apnea, yet 80% of cases go undiagnosed. The fragmentation of sleep is another hidden cost. With repeated apneas, you never reach sustained deep sleep. Memory formation and learning depend on uninterrupted slow-wave stages. Chronic disruption can lead to daytime confusion, memory lapses, and a faster decline in cognitive skills. Brain scans reveal that untreated moderate to severe sleep apnea accelerates shrinkage in regions tied to decision-making and memory by nearly 3 times the normal rate. Family members are often the first to notice: loud snoring followed by silence, then gasping or choking sounds. You may wake with a dry mouth, morning headache, or feel excessively sleepy during the day, struggling to stay awake during routine tasks. Chronic insomnia, difficulty falling or staying asleep, can signal sleep apnea or other issues like restless leg syndrome or hormonal imbalances. If you suspect a problem, talk with your doctor or a sleep specialist. A home sleep study or in-lab polysomnography can measure airflow, blood oxygen, and brain waves. The standard treatment is CPAP, continuous positive airway pressure, which delivers gentle air pressure through a mask to keep your airway open. Studies show CPAP can reduce cardiovascular risk by up to 42% in seniors. Weight management, sleep position adjustments, and avoiding alcohol before bed can also help. If CPAP feels uncomfortable, newer oral devices can reposition the jaw to maintain an open airway. Addressing insomnia with cognitive behavioral therapy for insomnia, CBTI, can restore healthy sleep patterns without heavy use of sedatives. If any of these habits sound familiar, don't worry, it's never too late to make a change. Small steps can make a big difference when it comes to protecting your health while you sleep. If you found this video helpful, give it a like and share it with someone who might need it. And don't forget to subscribe so you never miss our next health tip. Thanks for watching, and as always, sleep well and stay safe.